I have to say this is a very raucous group and meeting, but it's good. All good conversation. So we're getting to the close of the first day of our workshop. The fourth session is to address science and medicine issues and the implications of the questions we have around science and MRT in relation to the ethical and social implications that they raise. So chairing this session will be Alan DeCherney and Marnie Falk, so let me turn it over to you too.
Okay, so I'm going to start, and we'll start off with the kind of the patient orientation. The first will be Michio Hirano from Columbia, who's going to talk about women's attitude towards mitochondrial DNA and how they feel about MRT.
Right. Okay. Thank you. And I have a long list of collaborators. I just want to highlight Chris Engelstad, who's our genetic counselor who actually conducted these surveys, and our colleagues at Columbia, as well as the New York Stem Cell Foundation, and Mark Sauer, who's head of the IVF clinic at Columbia. Okay, so we'll go to the first slide, if I can get it to go. Oops, sorry. It's a delay here. Okay. So actually, we conducted two surveys. The first was a survey of mitochondrial DNA mutation carriers. These are women who are known to have a definite mitochondrial DNA point mutation. And our goals in this first survey were to assess the level of concern for transmitting these mutations. Second goal was to assess the support for the development of MRT in this at-risk mitochondrial disease community. And the third is to assess the personal interest among these women who are at risk of transmitting these mutations. The second survey was a survey of oocyte donors who would potentially donate oocytes for these kinds of research studies and for clinical use in MRT. So the first survey, as I mentioned, was on women who carry mitochondrial DNA mutations. So we only included women who were either known to be carriers of mutations or at risk through their maternal lineage. Of course, we restricted this to women and only adults over 18 years of age. We asked the first 4 questions. They were very simple questions. The first we asked was, have you thought about not having a child because you were concerned about passing on the mitochondrial DNA mutation? And this was a simple yes or no answer. The second question was, do you think that the project described above, and we of course described what MRT was about, whether MRT is important and worthwhile? Again, yes, no answer. The third question was, if you have stored eggs, would you be interested in donating them to Basic Laboratory for research to develop this technique, and with the assurance that no viable zygotes or embryos would be produced? The last question was, are you interested in becoming an egg donor? And a brief explanation of what that involved, including hormone injections at an outpatient clinic to obtain the eggs, and again, assurance that no viable embryos would be produced. Okay, the next 4 questions were focused on patients who said yes to this first question, are you considering having children now or in the future? So we only asked these questions to those who are young women who were in the childbearing age and were considering having children. The questions were, how important is it that your children are your biological offspring? And we gave them a choice of 3 responses: not important, somewhat important, or very important. The next question was, are you interested in using this technology to try to have a child? And again, a yes/no answer. And the last question was, would you be interested in allowing your eggs to be used for basic laboratory research in the process of developing an implantable zygote or embryo? Okay. For the donors, we only asked 2 very simple questions. The first was, would you be willing to donate your eggs for basic laboratory research? Not just specifically for MRT, but just in general, in which a viable embryo would not be produced. The second question was, would you be willing to donate your eggs for the production of an implantable zygote or embryo that has the father and the carrier's, mutation carrier's mother's nuclear DNA and your mitochondrial DNA? In other words, would they be willing to donate eggs for mitochondrial replacement therapy? We recruited patients through our clinics and our private practices. We recruited probands and as well as their matrilineal lineage relatives. We also included participants who had patients who have participated in previous studies at our center. We advertised through several mitochondrial disease advocacy groups and support groups, and through the North American Mitochondrial Disease Consortium. We recruited oocyte donors through a local fertility clinic at Columbia. So we got responses from 92 women who either carried mutations or were at risk of carrying mutations of mitochondrial DNA. I should note that there were several women who responded thinking that they had mitochondrial DNA mutations. When we examined their mutations, actually some of these turned out to be polymorphisms. So I think this is something that we should also consider when if we ever move this into clinical practice. We have to be very careful in screening the women to make sure they do really have mitochondrial DNA mutations. They were all, of course, over age 18, and these were the mutations that were represented among this population. The majority of patients had the MELAS 3243 mutation. Okay. So all of the women who participated understood that this procedure of mitochondrial replacement therapy, that they might transmit this mutation to their offspring. Of the women of childbearing age, about 80%, almost 80%, had thought about not having children because of the risk of transmitting this mutation. If women who had children already had known that they had this mutation, would they have thought about not having children? And the answer in over 70% of the cases was yes, they would have thought of not having children had they known they were carrying a mitochondrial DNA mutation. So obviously this carrying a mutation has a profound effect on what these women think about their progeny and the risks of transmitting a disease. When we asked them about the development of MRT and whether we thought this was important and worthwhile, the overwhelming majority, 95%, said yes. So I think this really amplifies the comments of Heather Ward this morning that women do consider this a very important technology. And okay, of the women who were actually thinking of having children, there were 21. 95% said that having a biologically related offspring was important. Over 50% said it was very important. 43% said it was somewhat important. Only 5% said it was not important to them. And when we asked them whether they would consider having mitochondrial replacement therapy to have a child, 90% said yes. And again, nearly 80% said that they would allow their eggs to be used for research in this sort of effort. Okay. And among the oocyte donors, these are healthy young women, mostly college-age students. We had 112 people who answered the survey, and all were adults. 92% said they would donate oocytes for basic laboratory research in general, provided that these embryos were not, viable embryos were not produced in the course of this research. And when they were specifically informed about the possibility of producing implantable zygotes, almost a similar number, 87% said they would donate towards eggs for the production of implantable zygotes, particularly for MRT. So in conclusion, among women who are known carriers, as well as those at risk for carrying a mitochondrial DNA mutation, there is widespread concern for transmitting the mitochondrial DNA mutations. 100% of the women said that. There is overwhelming support for the development and clinical use of mitochondrial replacement in this community, and there is widespread interest in this technology, particularly among women who are considering having children at this moment. And among these healthy oocyte donors, the vast majority are willing to donate for research purposes and for the development of MRT and for clinical use in MRT. So actually, I ended rather early, but I just want to acknowledge one thing, that this work was done through the North American Mitochondrial Disease Consortium. This is one of 22 consortia that are funded by the NIH in this rare disease clinical research network. And I just wanted to acknowledge their support which allowed the infrastructure to do this survey. And with that, I'll end.